portion of the CERF Retirement Seminar. So I am going to turn it over now to Robert Eastburn, who is the Retirement Plan Advisor for the CERF Savings Plan. And he is going to cover retirement readiness and just discuss some of those things that you need to be considering to answer that question, how ready are you? So Robert?
Thanks, Connie. And thank you everyone for joining us this morning. I know there's a lot of things going on, and out here in Southwest Missouri where I'm at, it is a beautiful fall-like day. So I'm definitely enjoying looking out the window, seeing those things happening, kind of the weather changing and all of that. I do want to talk to you though about change. And as you're thinking about retirement, there's a lot of changes that you're going to be looking at. And I want to say that as we're talking today, there's three huge categories we're going to look at. We're going to kind of look at the big picture and talk to you about your income, Social Security, health care, your budgeting, some of the psychological effects that happen in and near retirement. We're also going to talk about the details, talking about some investment principles, some withdrawal strategies. We'll talk about some taxes and some inflation concerns. And then I want to give you some resources at the end of our presentation today where you're able to go out and get more information on any of the topics we talk about. While we're talking about resources, I want to make sure that I restate what Jim did earlier. We are still here to help you, even though we're not conducting face-to-face meetings. One of the opportunities you will have at the end of this seminar, you will get a pop-up box onto your screen that says if you would like to schedule a private, confidential phone appointment with me to go over your account, go over your personal retirement readiness, that you can pick a time off of my calendar by using that link, lock in the time that works best for you and schedule your appointment. I'm going to encourage you that if you have personal questions that you don't feel comfortable sharing or asking in this type of a setting, to go ahead and schedule one of those meetings with me. I will say it's just like when I'm there face to face. You know, as those of you that have met with me individually when I'm in your counties face to face know that these are not sales meetings, they're not sales presentations. My job is to try to help you be as prepared for retirement as you can be. So when you get that pop-up box at the end of the presentation, please feel free to schedule a meeting if you have additional questions. So let's just jump into the big picture. So retirement income, where's your income going to come from? Well, there's a lot of different sources, but one of the key things is to say, how much income do I need? The so-called experts say that on average, a person needs at least 70% of their income they had while they were working to be able to have a successful retirement. Now, one of our goals is to see how close we can get you to 100%, to see how close we can get you to the point that when you're ready to stop working and retire, that you've got the same kind of income coming in that you had while you were working. But the experts say if you get to 70% replacement, you're probably in pretty good shape. So where does that come from? Well, it doesn't come from just one source. There's a lot of different sources, and we're going to talk through several of these this morning. Social Security can be a part of that. Your CERF pension, for those of you that are loggers, pension as well, both of those pensions. Sometimes people have rental income or farmland and things of that nature. Sometimes we're going to be looking at income from your 457 and your 401A that make up your CERF savings plan. And throughout this presentation today, I will be talking to the specific benefits of your CERF savings plan and how that works with some of these different categories. So I would ask you to think about this because this is an individual question. Do you have enough to retire? Now, we're not going to take time and survey everybody that's on the presentation today and just say, hey, what does your personal retirement dream look like? You know, some people might say, hey, I want to live on a beach somewhere. Somebody else might say, I want to see if there really is a limit to how many fish are in the lake. And, you know, all of those different types of retirement dreams have different expenses. So your retirement income is going to be different. Your needs will be from anybody else's because what you want to do in retirement is going to be different. So as you're getting to this point in your working career where you're thinking about, hey, am I ready to retire? Start asking these questions. Am I in a position to stop working? What are my expenses going to look like? What's healthcare going to look like? We're going to talk about that a little bit. Do I plan to continue to work or start a business? Where do I want to live? How close can I live to the grandkids? Can I live close to the grandkids but not the kids? I mean, these are all questions we have to ask, right? So one thing I would encourage you to do is on the Empower website, and I put a picture of it up here, there's something called a lifetime income score. And if you'll log in on the Empower website underneath your user ID and password, it will give you an overall estimate of how much of your retirement income we believe you're on track to replace. Now, this information is as good as what you've provided. So we know about your CERF savings, the 457 and the 401A. We have an estimate of Social Security, but you would need to input an estimate of your CERF pension from that estimate that Jim talked about that they mail out every year. And if you have logger's pension, you would need to input that in there to get an overall view. But I would encourage you, if you've not done so, to go out and take a look at that to get a good 30,000-foot overview in one place of what's everything likely to look like when I'm ready to retire. So let's talk a little bit about Social Security. So Social Security is, for many Americans, the primary source of their retirement income. But keep in mind, it's not meant to be the only source. And I want to share a few things about Social Security. The amount you get from Social Security is going to vary depending on when you start taking it. Everyone that has at least their 40 quarters, and so their 10 years of working history, can start Social Security as early as 62. But it is a reduction based off of your date of birth. If you were born 1960 and after, your full Social Security retirement age is 67. If you were born in 1954, your full Social Security retirement age is 66. If you were born between 65 and 69, you add 2 months for every year to age 66. So some of you may be 66 and 4 months, 66 and 6, and so forth. But essentially, if you take it at 62, Social Security does a formula to see how much of a reduction it would be by taking it at 62 versus waiting till your full retirement age. Now, I am a 67, so I was born 1960 or after, so I have to wait till 67 to get my full Social Security. If I draw it at 62, it will be exactly 30% less than what it would be at age 67, but I would have ended up drawing it for 5 more years. So that's a decision we need to make. Now, there is a latter date for Social Security that says if you wait beyond your full retirement age, which mine is 67, for every year I wait to start taking my Social Security until I get to age 70, it's going to go up by 8% a year. So if a person's working past their full retirement age, there may definitely be some benefit on allowing that Social Security to continue to grow until you're ready to take that. I want to show a slide. The next couple slides here show an average Social Security based off of what your income is if you were to take it at full retirement age. But then I want to spend just a couple minutes looking at this next slide. This next slide is the light blue bars at the top of each of the 3 categories. It shows how much total income you would draw from Social Security if you started drawing it at age 62. The gray bars show how much total income you would draw if you started at 66. This is assuming someone with an age 66 full retirement. And the dark blue shows what you would draw in total if you started drawing at age 70. Now, on the left-hand side, it says if you live to age 80, but you started drawing at 62, you draw about $223,000. If you started drawing at 66, you draw about $299,000. But if you waited till age 70, you'd actually draw a little less than if you started at 66 if you only lived to age 80. Now, this becomes a math question and a lifestyle question. For myself, I was able, and I went out to ssa.gov. I got my own Social Security estimate, and I saw what my payment would be at 62, what it would be at 67, and what it would be at 70. And in my situation, if I wait until 67 versus 62 to draw, I have to live to at least 78 years of age before I've drawn the same amount of money as if I would have started at 62. So if I look at my family of origin and my parents, my grandparents, my aunts, my uncles, and they all live into their 90s, well, it probably is indicated that I should, look at delaying my Social Security rather than taking it right at 62. But if I look at my family of origin and they were not a long-lived family, then maybe there's an argument to start it a little earlier. Now, there's a lot of information I've given you on this slide. Connie, I want to pause just a moment to see if any questions came in on that before we move on.
There are no questions on this at this time, but the one thing that I will say is if those in attendance, if you go to the bottom of your screen, again, just a reminder, if you want to submit a question through the Q&A or the chat bubble, the two bubbles that are fourth and third from the left will accomplish that. Also, if you click the fourth bubble from the left, which looks like a little person, you'll be able to see your own name, and there's a little hand icon that will appear next to your name. If you'd prefer to ask your question verbally, click on that, and then I will unmute you, and you can ask your question directly to Robert. So hang on one second. We did get one through the chat. What information do I need to go to ssa.gov and get my information?
Awesome. That is a great question. You're going to have all of that information. When I went out and registered to create my user ID and password, it asked me questions about me that I knew the answers to prove my identity, and then I was able to log in and get my estimate. And that ssa.gov is the Social Security Administration official website.
Okay, right now that is all we have, and I don't see anybody raising their hand, so I will go ahead and let you continue.
Okay, thank you. So again, this slide shows the ssa.gov, and I would encourage you, if you do not have a recent estimate and you'd like to know what your Social Security benefit estimate is, directly from Social Security, go out there and register and be able to download that. One of the things I do is I go out and check mine every year and just see what changes the next year of income has done. Now, this next grouping of sections ends up being a huge, unfortunately, surprise for a lot of people. But for many people, healthcare costs will end up being their largest real expense while they're in retirement. And we've got a couple averages on this slide that just shows a healthy 65-year-old male may need $144,000 on average to cover healthcare expenses, where a lady age 56 may need $156,000 over their life expectancy to cover their retirement healthcare expenses. And what's causing that? Well, we all know this. Medical services are getting more expensive. People are living longer, and people are retiring before they're eligible for Medicare. So let's talk a little bit about Medicare. And there's several things. Medicare's got a lot of moving parts. There's plans, there's tiers, there's gaps. I'm going to encourage you that I do understand the Medicare plan, but I don't work in that field. So as you're getting close to age 65 and getting close to retirement, you need to talk to some qualified professionals in here. But I want to give you a general overview of the different parts of Medicare and what it's eligible and when you should be enrolling. And I do want to say that there is a difference between Medicare and Medicaid. Medicare is the program for those of us that are retiring age 65 and beyond to cover our health care expenses, where Medicaid is a segment of medical services that is provided primarily to low-income individuals regardless of age. So when you think about Medicare, there's really four main parts to this. Part A, B, C, and D. Part A is the hospital coverage. That covers you if you have to go into a hospital. Part B is medical coverage for going to a doctor's office, outpatient care, clinical services. Those are Part A and Part B are considered traditional Medicare. Now, in addition to traditional Medicare, you can choose Part D, which is prescription drug coverage to your traditional Medicare. Or you could choose Part C, which is what's called a Medicare Advantage. And that combines Part A and Part B into one package and frequently combines Part D into another. Please understand, as we're talking today, I'm not making a recommendation of which one of these is best for you, but just an overall explanation of why there's so many letters that go with this. In addition to those, there's Medicare supplement plans, and these are really designed by private insurance companies for people that have traditional Part A and Part B of Medicare. And they help to cover some of the gaps that are in the two parts of traditional Medicare, because both parts of those are going to have co-payments, they're going to have co-insurance, they're going to have deductibles, and these are private insurance companies that are offering these supplemental plans to go on top of Part A and Part B, but they are regulated by the federal government. And just like your healthcare costs now, Medicare costs in retirement are going to have premiums. It's going to be an amount that they'll deduct out of your Social Security payment to cover that. It's going to have deductibles that you're going to have to meet for different types of services. It's going to have a copay, which is, a fixed amount that you pay for a service, like so much to go see a doctor or a specialist, or so much for an x-ray. And then it'll have what's called a co-insurance, which says once you've met your deductible, that on certain features, maybe Medicare will cover 80% of it and you'll pay the other 20%, for example. So here's what's key to know. This is true for everyone, regardless of when you were born. Your Medicare coverage is age 65. Your spouse's age does not matter in this. Medicare is an individual program, not a family program. You may enroll even if you work past age 65. And you may enroll even if you have health coverage through your employer or your spouse's employer. And you can enroll for Medicare regardless of whether you're taking Social Security or not. I get that question a lot when I'm working with folks. Now, I will mention that there is an initial enrollment period of 3 months before you turn age 65, the month you turn age 65, and 3 months after you turn 65. Unless you have a qualifying reason not to enroll for Medicare, you need to do that during that time period, or there could be gaps in your coverage or late enrollment penalties. And what those late enrollment penalties mean is that you pay more for Medicare coverage for the rest of your life. So this is why, as you're getting closer to age 65, you need to talk to a qualified Medicare professional to make sure you understand your situation and that you're not doing something that's going to increase your Medicare costs for the rest of your life. Now, you don't have to enroll. This is one of those qualified exceptions. If you, in your initial period, if you are still working and covered by a qualified plan. You also can enroll and make changes when you move to a new address, your plan changes its contract, or you lose your current coverage. I will also say that once you are in a Medicare plan, you don't have to renew your coverage every year, but there is an open enrollment period like many of you have with your employers where you can change your health care coverage now. There's an open enrollment every year between October 15th through December 7th where you can change your coverage. Maybe go from A and B to C, or C to A and B, and I'm just giving those as examples. But I will mention from my own personal experience with helping some of my family members to review their options on this, that sometimes the plans change significantly. And maybe you were with ABC Company on a Medicare C plan before, and you look at what their changes are for the next year coming up, and you see that XYZ Company is a better fit for you. Well, that's where you're going to do your research every year during your open enrollment period, during retirement, to see which plan is best for you. I have two resources I want to give you. Again, I'm going to encourage you to go back to that Empower Retirement website. Up at the very top, once you log in, there's a healthcare cost estimator. And this will allow you to go in It'll allow you to select what state you plan to retire in and what age you plan to retire. It will give you a choice of some common health conditions individuals may have, and if you select any of those, it's going to give you an average estimated cost that those individuals are paying with those health conditions for health care. So it can get you an idea of what healthcare costs might look like for you when you're ready to retire so that you can start planning for that now. In addition to that, I want to give you this Medicare.gov website. And just like the Social Security website, this is the official website for Medicare. And one of the things you can do when you go out there and look at that is to put in your zip code and see what Medicare plans are currently offered in your zip code, who they're offered by, and what their cost, coverage, and exclusions are. Now, I will tell you that when I work with my family members on this, we spend quite a bit of time on this Medicare.gov website looking at what's available to them. It's extremely user-friendly, and I would encourage you to spend a little bit of time out there to get an idea on things. I will just reiterate on this. Healthcare cost is a big deal. And if you retire before age 65, you need to have a plan for how you're going to cover your healthcare cost until age 65 when the Medicare plans become available to you. So Connie, I'm going to stop for just a moment and see if any questions came in about the Medicare or healthcare cost in general.
Yes, hang on 1 second. Do you happen to know, is the open enrollment period the same with Medicare and ACA open enrollment period? I'm not sure. Robert, do you know what's being referred to with regard to ACA?
I am unsure of that. Can we get some clarification on what the ACA stands for?
Obamacare, sorry, Affordable Care
Okay.
Act. Now that she says that, it makes total sense. But on the spot,
there you go. I do not know that they are if they are the same or not. I know the Medicare plan is the same open enrollment period every year.
Okay, thank you.
Okay, what I'd like to do now is go ahead and switch gears just a little bit about talking about your own retirement plan. And we talked about earlier that everybody's plan is going to be a little bit different. Well, if your plan's different, your expenses are going to be a little bit different. And one of the things that you can do is to help get an estimate of a retirement budget for yourself. And one of the things that I would encourage you to do is when you think about that, is it can really help you look at your plan and your goals and see where you're at and help you make some decisions. It will help you prioritize your future spending. It may help your retirement savings last longer to have a budget and an expense plan for that. And it may help you to reach your financial goals. I will tell you that one of the things that I frequently do when I meet with people individually, and right now that's virtually and individually, is to look at what percent of your income you're tracking to replace. And then we can look at that and say, hey, are we on track? Are there major expenses that you're going to have in retirement, or is it going to be pretty much like it is today? Because most of us end up in retirement having the same type of expenses, maybe a little bit less, but the similar type to what we have while we're working. And if that's the case, if we can replace your income and get to that point where you've got a good solid income projection all the way through retirement, that can really be a help in addition to doing these budgets. But as you're thinking about the budgets, things to think in mind are your current monthly expenses, things that are fixed. So fixed expenses are going to be things that are going to happen every month. Your variable expenses are things that are going to be occasional or going to fluctuate from month to month. Look at what your retirement expectations are going to be. If you're thinking I'm going to sell the current house, I'm going to move somewhere else, then we need to be planning for those expenses. And then take a look at what your income is going to be for between your Social Security, your CERF, your loggers, if you have loggers, and then what you can draw from your CERF savings plan. So again, I mentioned as you're thinking about your expenses, fixed expenses are the things that are going to be the same every month, like mortgage or rent, insurance payments, a car loan, for example, Variable expenses are things that are variable. They're going to change from month to month: gasoline, groceries, utilities, things of that nature. But then here's some personal questions you need to be thinking about. Am I going to move? Are there improvements I want to make to the house? I hear that a lot. Are there vacations or hobbies I want to pick up? How much do I want to spend on the grandkids? And this is something that's relatively new for this generation of retirees. Is not only do you have your kids and your grandkids, but you're also helping to take care of parents as well. So these are all things that as we think about retirement, we need to be thinking about, how does this impact my plan and my goals? So again, if you're going to do a budget, start from your current budget and let's build up from there and see what expenses are going to look like. For example, sometimes I'm working with people and they tell me, Robert, my house is going to be paid off before I plan to retire. Well, that makes a big difference in their retirement plan if you're in that type of a situation, for example. Now, this is something that a lot of times we don't think about. But this is something that my wife asked me a couple years ago now. She said, Robert, she says, what do you plan to do when you retire? She says, I've got all of these hobbies, all of these things that I do. She says, you just kind of work. So when you retire, what are you going to replace all of that time you've been spending working doing? And there's an emotional side to retirement that a lot of times we don't think about, especially if we're used to going into a location and working every day. And that, what are we going to fill that time with? And a lot of times people go through several different steps where they're interested in retirement. We're all interested. That's why we're here today. And we get to retirement, we're pretty excited about it. And then there's kind of some stress, things about, wow, is everything going to hold up during retirement? How are things going to work for me? Then we kind of get down to this new normal. And I would just encourage you that as you're thinking about retirement, give yourself permission to have some emotional ups and downs with this, especially as you're transitioning into this. We all get excited about retirement, but it's all new for every one of us, right? None of us have done it before, or very few of us have. So this is something new. It's a big step in life. It's a big transition in life. So be prepared to have some emotional changes that come with retirement. Some things that may help with that are hobbies or volunteer work, part-time work, or starting a new business, something you've always wanted to do, sports or activities or social engagements. These are all things that can help structure those times and make it a fulfilling time of our life as well. We've spent a lot of time this morning talking about the big picture. Now I want to focus in, and this is where we're going to talk the most about your CERF savings benefits, your 457 and your 401A, as we talk about the investments in your plan. And so the first thing I want to do here is just give a general overview of how the 457 and the 401A works. The 457 is optional. You decide how much you will participate in that. If you put money in, it comes out of your paycheck currently as a pre-tax deduction, meaning that it goes into the retirement account before taxes are withheld. It reduces your taxable income. There may be some tax benefit to you for that. That money goes into the 457 plan and it grows tax deferred, meaning you're not paying any taxes on the earnings that it has every year. But someday, when you get to retirement, you get to decide how much you're going to take out, and you're going to take it. But when you take it, it will be taxable income. Now, in addition to the money you put in, historically, the CERF plan has put a match into what's called a 401A for you. Now, since about 2007, the way that match has worked is for every dollar you put in, up to 6% of your salary that you put in, CERF puts in 50% of that. So if you were to put in 6% of your salary, CERF would put in 3% of your salary on an annual basis in matching funds. Now, the reason I said that it's been this way since about 2007 is that this matching component is voted on every year by the board of directors of CERF, and it is subject to change. For 2020, it will continue to be that 50% match up to 6% of your salary. So if you put in 6%, they would put in 3% for you. If you are not doing the CERF savings plan, I would strongly encourage you to schedule a meeting with me to talk through kind of what your goals are, to see if doing that and capturing any of that potential matching money would be a benefit to you. Now, in addition to that, if you are in a non-loggers position, if you are not covered by loggers, there is a 0.7% mandatory contribution that goes into the 401A. So there's some different rules that apply on that, whether you're a loggers covered employee or a non-covered employee. So that's a general overview of how that plan works. I want to start shifting gears just a moment here to talk a little bit about how the money's invested inside of the plan and ultimately what that means to you. In a general sense, the longer you have before you need the money, the higher risk investments you can afford to have inside of the CERF savings plan. The closer you are to needing the money, the more conservative we may need to go. And the reason I say generally is everybody's situation is a little more different, and I can give you specific personalized advice based off of your situation, but in generally that is true. Now keep in mind on that I said until you need the money, not until the date you retire. And let me explain the difference. Life expectancy for ladies is in the upper 80s. It's in the mid 80s for gentlemen on average. What that means is sometimes when somebody retires in their early 60s, they could have 25 or 30 years of retirement. And especially if you've done a good job saving and you've got your pension and your Social Security, maybe both pensions if you're a loggers covered employee, you may actually end up getting a pay raise when you retire and make more from your Social Security, your CERF pension, and your loggers pension than you did while you were working. What that may mean for you is that you don't need the money in your CERF savings plan on day one of retirement. You're going to need it later. So we need to think about managing that money all the way through retirement, not just to retirement. And there's a big difference for that. Now there's three, in Empower, we recognize there's really three types of investors that are out there. There's a group of people that want to do it on their own, and that is fine. We call that a do-it-myself. And there's some tools on the website, and I'm glad to talk through your options with you for people that say, hey, I want to take care of it all on my own, but I would like to talk to somebody and make sure I understand what's going on. That's fine. We've got another group of people that like some help doing it, but they still want to be completely in control. And we call that a help me do it investor. And there's some target date funds and some tools on the website that will guide you into what's the best overall investment mix for you, but then you're still in control and you make those decisions. There's a third group of investors out there that are really to do it for me, but I would prefer to have a professional person manage my investments, review it on a regular basis, and make adjustments to keep me on track. And that is available through your plan as well for a small cost. So if you've got questions about your investments, what type of an investor you are, whether your strategy is tracking to keep you on track for what you need throughout retirement, that would be a good set of questions to talk to me about on one of those individual private meetings. The My Total Retirement is that professionally managed service where after doing a one-on-one, we develop a personalized plan, we evaluate everything for you, we make the changes for you to keep you on track. Again, that one does have a fee with your plan, but that is something where the fee is just directly taken from your account rather than a separate charge sent to you to pay. I will encourage you, regardless of what type of investor you are, that you really should go out and take a look at your investments. Sometimes I will be working with a person individually, and we'll look at the account, and they may be 60 years old, and the last time they changed their investments was when they were 40. And, you know, as we get closer to retirement, we do need to make some changes. So if it's been a while since you've looked at your investments, it's going to be a good idea to review those and make sure that the investments are a good match for you at this time in your working career and in your journey to retirement. So I will give you some resources here on that empowerretirement.com website. to be able to go out and look at that. And again, if you go to empoweringmymoney.com, there's some questionnaires, there's some things out there to help you see what type of investor you are. And if you really would prefer to have the professional help, just a little bit of guidance, or just completely do it on your own. I do want to talk a little bit, and Connie, before we get into withdrawal strategies, have any questions come in that we need to address at this point?
Yes. Excuse me. Yes, Robert, we have one, and that is it ever a good idea to have 100% of my account balance in the Great West Portfolio Fund?
Connie, that's a great question, and I hate to say ever or never, but I'm going to say it is almost never the appropriate and optimal fix to do that. The Great West Portfolio Fund is a good fund to have a portion or a chunk of your money into that needs to be secure and a fixed income product. But one of the dangers of having all of your money in any one fund like that is, are you earning enough to keep up with inflation longer term? And the longer time before you'll be pulling that money out, the more danger you run of not keeping up with inflation. So that's a great question. And again, I would encourage anyone that has questions about their investment strategy and their current investments to schedule one of those one-on-one meetings with me. We'll look at their plan and see if maybe that is a great fit for them, or if some other choices would be better. But no, that's a great question. Did we have any others come in?
We did. Another one just popped up. So once I retire, am I still able to meet with Robert?
Absolutely. As long as you have money in your CERF savings plan, I am always available and glad to meet with you. That is a part of what your CERF benefit provides to you, is those individual private meetings, regardless of whether you're working or not. All
right, that's it for now. Oh, wait, hold on one second. One just came up. They're coming in. Let's see. Is that Great West Portfolio one for saving or lower risk plan? Okay, so the Great West Portfolio Fund is designed to be a fixed income product. Right, the balance in the Great West Portfolio doesn't fluctuate up and down. It just pays interest. So it really is designed for a person to have a portion of their funds inside of a fixed income product that they don't want in the general market. You know, if I was looking at maybe withdrawing all of my money from the savings plan in the next 30 days, I might consider that, just to lock it in so there's no fluctuation. But as a general rule, a person wants a portion of their money in that type of a fund, a portion of their money in more moderate investments, because that's extremely conservative, and maybe a small portion of their money, especially in retirement, in more aggressive investments to try to help them outpace inflation. So we really want to try to balance those conservative, moderate, and aggressive investments so that the overall picture works out right. Connie, a lot of times I think of that kind of like a jigsaw puzzle. You know, if I pick up just one piece of a jigsaw puzzle and look at it, I really don't know what the whole picture is. And it's hard to see what's coming out. But if I get all of the pieces and put them together, then I've got a good idea of what the picture looks like. And investments and investment strategy is an awful lot like that. We've got this piece that's real conservative, this piece that's moderate, this piece that's maybe a little more aggressive. And we want to put them all together to see the overall picture and come up with an overall plan rather than just looking at just one component by itself. All right, thank you. And it seems like awesome. As soon as you finish one, another one comes up. So oh, okay. No, that was it. That was it. Okay. That was just a thank you for your response to the previous one. So thank you for that. Oh. So, okay.
Awesome. So what we're going to talk about now is how you get your money out of your account. And we'll spend a little bit of time on this, but essentially the CERF savings money is available to you however you want to get it. When you are separated from county employment, the money inside the 457, that's that voluntary money you put in, is available to you at any age once you no longer work for the county. and have been off payroll 30 days or longer. The money in the 401A, that's where the match goes, or if you're required to do the mandatory 0.7% because you're a non-loggers covered employee, that money is available penalty-free, however you want to take it, at any age after 59 and a half. Now, in both cases, no matter when you take the money, it will be taxable income to you in the year you take it, or you take any portion of it. So sometimes people will they retire, they've got money in the 457 and the 401A. Sometimes people will take it all at one time to cover an expense they have. Well, if they do that, all of that money would be taxable in that 1 year. Sometimes people say, you know what, I don't want it all right now. I'll tell you when I want to start taking some, and they let it stay in the account and continue to grow through retirement until such time as they need it. Other times people will say, okay, Robert, I need $100 a month out of this to go with my pension and my Social Security. So we send them $100 every month, and as we do that, it's taxable. Now, the IRS code right now says that a person has to pay, or we have to withhold a minimum of 20% for federal income tax to send it in off of any of those payments that come out of the account. Now, you may not owe 20%. You may owe more or less, and you can tell us to withhold more, but the IRS will not allow you to tell us to withhold less than 20. So let's say we withhold the 20% and you do your taxes and it only comes up that you owe 12%, for example. In that example, you'll get a refund at the end of the year when you do your taxes for any overpayment, but we are required to withhold the minimum of 20 and send it in. So that being said, you have a lot of options on how you're going to take your CERF savings money when you get to retirement. So there's some key things to think about. Longevity. We need to think about investment returns. We need to think about inflation. And we need to think about our expenses now and our future expenses as we're planning our withdrawal strategies. And again, this is something I'm glad to help you individually, but I do want to give you just a few example strategies. One example is what's called a constant dollar amount, where you start taking the same dollar amount every year out of your balance and you adjust it for inflation. So every year it goes up just a little bit, but basically it's the same dollar amount. Another one would be to take a constant percentage, say 3%. I'm just making that up as an example, out of your balance every year. And what that does is in a good year, that 3% goes up. In a bad year, the 3% might go down. So there's pros and cons with each of these strategies. There is what's called a required minimum distribution, and Jim talked about it earlier. And essentially the way it works is if you did not turn age 70 in 2019, then by age 72, you are required to start taking some money out of your CERF savings plan every year, whether you want to or not. It's IRS rules. There are charts that we follow on that, and Empower will let you know how much is required to come out. And some people just say, you know what, the only thing I want to take out is the amount I have to, those required minimum distributions, and that's a valid strategy as well. I will tell you, if you are still working for the county and over age 72, you can delay those required minimum distributions till you retire from the county. And then the final strategy I just want to talk to is what's called a capital preservation. And basically that just means you're going to take off the earnings every year, whatever that is, and leave the principal, the amount that's in the account itself, safe. So I do want to give you another resource on the EmpoweringMyMoney.com website. There's a withdrawal calculator that lets you play with some of the numbers and kind of get an idea of how long your savings plan would last, your balance in your 457 and 401A, based off of how much you're taking out each year. Any questions on that, Connie? Okay. Mm-hmm.
Yep. I was just popping in to ask you a question. So, and this is probably from a couple of slides back. And the question is, can you use your retirement like an immediate annuity and then after 59 and a half, so we wouldn't need to transfer it anywhere? So it sounds like the question is around those, the level payments option that you just covered.
Okay. So one, if your balance is over $1,000, you are not required to send your money anyplace else. Okay. The way that the plan allows you to do this, you can tell me, I want to take a set amount, say $400 a month until it's gone. And we'll send you $400 a month till it's gone. Unlike Social Security though, and unlike your pensions, let's say you go along for $400 a month for 3 or 4 years and you decide, I need to change that amount. In the savings plan, you have the opportunity to change what you're taking out. So you can turn it into something similar to an immediate annuity, but basically there is a pile of money there. And when that pile of money is gone, it stops paying. Now, if that pile of money doesn't go away during your lifetime, your beneficiaries are going to get whatever's left in that pile of money. So it's similar in function to an immediate annuity, other than there is the possibility of depleting it over time, or the possibility of leaving it to your heirs if you do not deplete it. Any follow-up question to that, Connie?
What age, and I think you may have just covered this, what age do you have to start taking money? So just could you reiterate on the required minimum distribution, please?
Okay, if you have not turned age 70 by the end of 2019, then your required minimum age is 72. If you had turned age 70 by the end of 2019, your required minimum distribution age is 70 and a half. So for most of us on the call today, it's probably going to be age 72. Having said that, while you're still working for the county, you can delay that until you actually retire from the county if you choose to. But Empower will send you a notice as long as you have funds in the account of what your required minimum distribution is, and then you let us know how you want to take that. Sometimes, Connie, I will say this, I sometimes get this question. People get a letter or they find out the required minimum distribution is $1,200 and they're taking out $150 a month already. Well, that $150 a month is going to add up to $1,800. It's not an additional $1,200 beyond the $150 in that example they were already taking. So if they were already taking money out on a monthly basis, that may satisfy their required distribution. Of course, that's based off of everybody's individual situation and what they're doing. But it's not additional beyond what you were taking out if you were already taking out more than that.
Okay, thank you. That is it for right now.
Okay, so I did mention taxes earlier, but again, keep in mind that this will be taxed as ordinary income when you take it out based off of your plan. Now, depending on your other sources of income and other sources of deductions, you may or may not owe taxes, just like you don't necessarily owe taxes on 100% of your salary right now because of deductions. That may be the same case for you in retirement. I will mention that the more income you have in retirement, the higher the probability is that a portion of your Social Security benefit will end up being included in your income when they calculate your tax. Boy, that was a mouthful, getting all of that out. But essentially what that means is the more income you have in retirement, the more likely a portion of your Social Security payments will be considered income and then taxed. I just want to give this as an example. These numbers are likely to change before you hit retirement because they get adjusted every year or two. Right now, if a person is filing individually, if their total reportable income is under $25,000, none of their Social Security is considered taxable. But if their income is between $25,000 and $34,000, then up to 50% of their Social Security could be taxable income. Now, that doesn't mean 50% of their Social Security will be paid in taxes. It just means it'll be included in your income when you calculate your taxes. And in the individual case, if you make more than $34,000 a year, then up to 85% of your Social Security payments would be considered taxable income for when you calculate what your taxes actually are. At this time, it's never 100% of your Social Security. is considered taxable income. Also keep in mind when I'm saying taxable, I'm talking about federal income tax. Social Security payments are not subject to Social Security tax, like the FICA that's only subject to federal income tax under current tax laws. So when you take your distributions as well out of your CERF savings plan, your 457 and 401A, it is federal income taxable, but not Social Security taxable. Just keep that in mind. Having said that, I am not a tax advisor. I do not play one on TV. I would encourage you, if you have questions about your own tax situation, to talk to a qualified tax professional to see how things may impact you, since everyone's situation is different. I do want to take a few minutes, though, and talk about inflation and how that may impact you throughout your retirement. This particular slide shows on a national average the inflation effects on the prices of things across the United States from 1980 to 2018. And as you can see, everything is more expensive, of course, in 2018 than it was in 1980. We expect that to happen, but some of the things are had significant increases in price. For some of them, the prices did not go up as much. The reason we use that is that's almost a 30-year period. That's a 28-year period. And during that, that's, for many people, a good expectation of what their retirement lifetime is going to last. I want to show you, though, what has happened in the markets in over a 30-year period. And over a 30-year period of time, when we look at this at the far right, the yellow dot, $1 would actually buy as much as $3.24 would at the time of the end of 2018 for 30 years going backwards. If you had invested $1 in a capital preservation fund, the average capital preservation fund would have earned $2.43. So if I put that $1 in there thinking 30 years later I was going to use it to buy something with, it would be worth on average about $2.43, where the price of something that was $1 30 years ago would have been worth $3.24. So it would not have kept up with inflation. If I had put the $1 into a good mix of bond funds, though, it would have grown up to $5.90. So it would have outpaced inflation. Or if I would have put it in a large company stock funds like the S&P 500, for example, the value of that $1 would have been $17.30. Now, we all know that stock funds don't get there by going up, up, up every day. They go up some days and down some days. But over time, historically, they have gone up more than they've gone down. I'm showing you this slide not to recommend that you put all of your retirement in large company stock funds. That's not a good long-term strategy, but a good long-term strategy would be that we should have a mix in these stock funds, a mix in bond funds, and a mix in capital preservation funds for most people, so that overall we can have a good, stable income source from our savings plan in retirement while still outpacing or at least keeping up with inflation. So if you are too aggressive in retirement, if we have a downturn, then it may impact our principal. So that could be a negative. But if we're too conservative in retirement, then our purchasing power can be eroded due to the cost of inflation. So this is kind of the Goldilocks thing. We don't want it to be too hot or too cold. We want it to be just right. And we need everybody's just right. It's going to be a little bit different. And again, that's on your investments. That's something that I can help you with in those individual meetings, is to help you with your approach to see what approach gives you statistically the highest probability of you being where you want to be when you want to be there financially in and through retirement. So I do want to just give you some additional resources. These are websites, the FSA.gov, the Medicare.gov websites are sites that I gave throughout the presentation. If you have questions about taxation, the IRS.gov is out there. There's also a Plan Sponsor Council of America website that gives more information about retirement plans in general. I do want to provide you with that. I do also want to mention today that you can go to the Empower website, log in, see your own account, see what you're tracking for. You can do that off of an app. You can do that on a smartphone, for example, off of an Apple Watch, or off of a laptop or a desktop or tablet. I am going to leave this screen up. It has my personal cell phone. It has my email address. In addition to when this presentation is over today, you getting the pop-up box where you can schedule an individual meeting. These are ways you can reach out to me if you have questions, and I will certainly be glad to help you. Connie, that ends my presentation today. Were there any other questions that came in that we need to touch on?
Yes, there are a couple. So the first one is there an early withdrawal penalty on the 457 or the 401A?
So the 457 and the 401A have different IRS rules. The 457, once you leave county employment, you can get into it at any age without an early withdrawal penalty. It will just be taxable. The 401A, if you tap into that prior to age 59 and a half, there will be a 10% IRS penalty that is applied in addition to the normal taxes. Now, while you are working, the IRS says you have to have what's called a qualified event to be able to take money out of either one of these plans. And a qualified event is reaching age 59 and a half for either the 457 or the 401A, or there may be some particular hardship things that would qualify a person to withdraw funds. And if you have questions about that, that's really one of those times where you and I should talk on an individual basis to see if you would qualify. What other questions came in?
I'm sorry, can you please refresh on what the contribution limits are for 2020?
Okay, so if a person is under age 50, they can put in up to $19,500. If they are age 50 or over, it goes up to $26,000. Both of those are capped that you have to make at least that much from the county to be able to put that in. But you can put in that amount. However, the first 6% of your salary is the only amount that would be subject to matching rules. So if a person were to put in, say, $15,000, $20,000 into the 457, even though they may be eligible to do that, they may not get matched on all of that. They may only get matched on the first 6%.
All right, thank you. And again, if anybody would like to ask a verbal question, if you click on the little hand icon next to your own name, that will notify me and I can unmute you. At this time, I do have another question that came in that is really for Jim. So I'm going to go ahead and ask that. And then again, if you have questions for Jim or for Robert, please submit them through the chat or the Q&A portion. But Jim, do you ever foresee a time when CERF and loggers would get together to provide gap health coverage for early retirees? And so, Jim, I'm going to unmute you right now.
Thank you, Connie. Thank you for the question. I do not foresee that myself. CERF and loggers were both created by state statutes, and there are different state statutes for CERF and for loggers. So any change like that would require going through the legislature and changing those statutes, and I have not heard any talk of that.
Okay, thank you, Jim. And then I have had several questions regarding the presentation and will it be available and can we print it and that sort of thing. So again, give us a couple of days and the presentation will be posted to the mocerf.org website. So you'll be able to access the recording there as well as the presentation there as well. So at this time, I'm not seeing any other questions. Oh, hold on a second. As soon as I say that, I received the little chat function. So, okay. So not a question, but a compliment. So thank you. We appreciate it. Very good information. Appreciate all of this. Thank you. So thank all of you for attending. We really appreciate all of you attending as well. When you close out of the seminar, you're going to get a little pop-up window that's saying an external window is trying to open. If you accept that, that will include a brief survey for the seminar today. And I know everybody is probably surveyed to death, but if you could take just a couple of minutes, it will take you probably less than a minute or two to complete that survey. We really would like to hear your feedback. We are conducting these pretty much on a at least quarterly basis, so we want to try to improve them as we go. And in addition to that, oh, sure, go ahead, Jim, I'm sorry.
May I just say thanks to all the public servants out there. County employees truly are public servants, and we know you didn't go into county government for the money and the glamour, but your communities are better places because you showed up to work every day, and CERF is all about providing public servants a dignified retirement. That's all we're trying to do. Nobody's going to get rich off their CERF pension, but it might make a big difference in people's lives, and the CERF savings is a great way to supplement that. The public employees are our heroes, even in normal times, and certainly during a pandemic. These folks are going to work, they're going to the courthouse, maybe they work in law enforcement, maybe they work for Road and Bridge. They can't work from home. They're out there dealing with whatever's out there, and so we appreciate them so much.
All right, thanks, Jim, and certainly we echo at Empower that exact same message. And so I also encourage everybody that attended today to reach out to CERF, and Jim provided you with a lot of resources that you can reach out to. Also, when you close out of the presentation today, you're going to get a thank you for attending message that includes Robert's time tap link, which means you can just click on that and schedule an individual appointment to have a meeting with Robert. And so we really encourage you to take advantage of those resources. That's what they're there for. We really want you to take advantage of those so you can get the most out of the CERF pension plan, as well as the CERF 457 and 401A plans. So with that, I don't see any additional questions. So again, thank you all for attending, and have a great rest of your day.